I want to welcome you all into Coronavirus Inside the Arizona Numbers, where we take a closer look at the data coming out of Arizona so that you can make the best decisions for your family and your life. It is February 8th, 2021. I'm Katie Ramo. Alongside me here, Garrett Archer, to help us better understand some of these numbers. A lot of them going down, a lot of good news to report to you. We'll go through it all. We'll talk about the vaccination sites. All eyes were on Arizona today, though. President Biden and Kamala Harris taking a virtual tour of State Farm Stadium to see how things are going out there, see how the vaccination site is working, and perhaps model some things like they're doing across the country. So all eyes were on Arizona, and we'll talk about some of those numbers as well. And if you're still having a little trouble getting signed up, we can talk about that too. So Kristen's writing, hey friends, it's been a while. It has been a while. This is our first day back since last week. So we missed a couple days. We'll try to get you guys all caught up on everything. We've been on some other assignments as well. So anything we missed, we'll get you caught up on, and just post them in the questions and we'll get to those. But Garrett, we're seeing these case numbers not as high. Today's in the 2000s.
Yes, today is absolutely not as high. Let me see, I've got this up. 2,250 was the reported number of cases today. The number of deaths reported 7. What has that done to our 7-day averages? As anybody who's followed this program, we know that we like to go and talk about the 7-day averages of the reports because it gives us a better, more even idea of what's going on. Pardon me. We are at under... Our 7-day average is at 2963. This is the first time that our 7-day case average of new cases added has been under 3,000 since November 19th. It's a 40% week over week decline. Now, with all that being said, the number of deaths that we're seeing is still at basically 130, and it's been, the 7-day average has been at 130 since about February 2nd. So we've had about 6 days where that number has not moved. And we did talk about in the last couple of weeks that while we were seeing a case decline, and we knew that we would see a case decline, that the number of deaths would continue to be level. They probably wouldn't peak again, but they were going to be level, and that's what we're seeing right now. So where we're going to be in the future, it does appear that now that we're about 2 weeks outside of the case decline, that we should now start to see a corresponding decline in deaths. Should start happening basically by this week or the next week. As far as Super Bowl, Carol, let's see what happens 2 weeks from Super Bowl. You are absolutely correct as far as if anything is to come of Super Bowl, it is going to be reflected in the data in about 2 weeks. You are entirely correct. Will it affect the data? It's hard to tell. We've had sort of one-off holidays before, or one-off gatherings before in the data, and it didn't really cause a surge. I'm thinking about Labor Day, for example. There really wasn't a major surge on Labor Day because of just that one sort of holiday standout. Really, the surges came during the fall and really started to pick up when we passed sort of the holiday season. We really got into the seasonality of the winter, and we had more. There's just a whole bunch of combination of things that happened in Arizona that helped increase our numbers. But as far as the Super Bowl, yes, 2 weeks. We'll see if that did anything. And also, it's difficult to tell if it is going to actually change the numbers. It may spike them a little bit, but it probably won't turn into a sort of a third stage surge just because of Super Bowl. Now, that being said, B117, the UK variant, is gaining steam all over the place. It is a little bit more it's a lot more transmissible than the standard variants of COVID-19. If for some reason that was more prevalent in Arizona, that people didn't know they had it, could it cause a bigger spike? Absolutely, because it is simply just more transmissible than what we've seen out there. But that's, again, remains to be seen, and we wouldn't be able to pick it up for at least 2 weeks.
Yeah, and we're seeing this sort of reflected around the U.S. too. The U.S. caseload for the first time went below 100,000. We haven't seen that. We're at 93,000. We haven't seen that since November 2nd. So maybe tracking any kind of uptick, it might be difficult to see. Hopefully that's the case, that we won't see a huge spike after something like this. You were mentioning these death rates going down this week, Garrett, or the possibility of that starting to happen. and hospitalizations are down as well. Those are all signs of it. Just to remind everybody, we would normally go through a case load and then hospitalizations and then ultimately deaths. So they come in sort of three waves, and we're hoping that this last wave is here and we're going to be on the other side of it for at least the numbers in these death counts. An interesting anomaly that we haven't seen in a while that really only happens on Mondays, Garrett. The number of new deaths reported in today are 7 across the state, but if you click on Maricopa County, it's actually 8. Yeah, it's actually a number higher. So that would be an adjustment in some of the surveillance in the death certificates.
And that is exactly. And that means that if we go and scroll through these counties, there's going to be, there it is. So Cochise County is the one county that had a withdrawal today. And that's why we had a number 7. So there, it's very often, by the way, and you know this, Katie, that we do not even see barely any death reports on a Monday.
Mm-hmm.
This is a more common than not that the death reports simply don't. We'll just have a bigger one tomorrow because a lot of the county health departments weren't doing death reports for the weekend. And so they just haven't updated the database. So as you said, this is an adjustment by Cochise County. Maricopa County, there were 8 that were included. And then tomorrow, that's basically going to roll up everything else.
So we'll have those numbers for you tomorrow. In the meantime, I want to stop for a moment on our inpatient numbers because those are trending down quite rapidly. That's great news for families who've been away from loved ones because they were in the hospital fighting this, and obviously awesome news for our healthcare workers because the workload was so high because everyone was jammed into these hospitals, but it's looking a lot better. Look at that steep decline there.
Yeah, I mean, realistically, we're looking at a 40% decline from here to here, from our peak on the 12th of January, which really was only that was only about 4 weeks ago, a little less than 4 weeks ago. We're looking at basically a 40% decline in hospitalizations. We're in fact back at the point, at this 2853. We're finally at the point where we're actually matching the decline from the last summer surge now as far as these numbers. We're now looking at where we were, say, on July 23rd, rather than being, up here in this number where, we hadn't even matched that yet. So 40% decline in inpatient numbers, even the ICU. This weekend, we saw the highest decline, the largest decrease of hospitalization day over day numbers that we've seen since September. It was this one right here, I think. It was yesterday, 24 to 25. I think that was it. That 909. It was about 50 hospital ICU beds that went down in one day. 6% decrease, highest we've seen day over day. Ventilator use going down at about the same rate as ICU, and again, we can expect that. And unfortunately, the ICU ventilator rate ratio is still fairly high. It's still in the mid 60s. And that means that we're still going to expect, a lot of those deaths that are in, a lot of these numbers in the ICU, very sadly, are going to be end in death. It's not going to be that, 828 people make it out. About 400 or so will make it out and the others won't. Very sadly. The discharge numbers are also going down. You can see we're at 516 now. We are now at a point where we're almost where our highest discharges were in July. And then our emergency room departments, also a massive decline, 1,400 there. And as well, intubations, big decline there. So all across the board, declines everywhere.
That's great news for, like I said, our hospital staff and also all those families that were far away from their loved ones as they fought this. Morgan's asking, data dump tomorrow with the super low tests reported today. It's kind of what you just touched on there. It's entirely possible, Garrett, on a Tuesday.
It is. Yeah, Tuesdays can be the largest day. And so there is a chance that we'll have a larger than normal dump of data for tomorrow. Now, what does that actually mean for us? Right now, it doesn't mean that we're going to see a spike to like 9 or 10,000. That would be extremely extraordinary. And at this point, the ACDHS would have to give us a explanation, if you will. If for some reason they drop 10,000 cases on the board tomorrow, they owe us an explanation as to why that happened.
Yeah, why there would be a huge jump there.
Really, the highest update, the highest case number we've had since, I want to say, the 1st of February has been 4417. And so what I'm expecting tomorrow is anywhere, it's very likely going to be over 3,000. It'll probably be between 3,000 and 3,500. But again, we don't know. This is literally a guess just based on how our numbers have sort of looked in the last week.
Mhm.
And so it's very plausible that that's where it's going to end up, but it could really be, it could really run the gamut. We never know. But again, for Super Bowl, we're not looking, even the first transmission that could come from a Super Bowl party is not going to show up into the data until let's see, maybe Friday,
Yeah. Yeah. At
and
the earliest.
that's the absolute earliest that we would see anyone that could have contracted anything from Super Bowl weekend. And again, that's a big could. I don't want to make anyone, think that I'm, just letting you know. That's
Right.
just if we start seeing spikes, it's going to come around Friday to say next Wednesday.
Okay, so we are 1 year out now since we lost the first American to coronavirus, Patricia Dowd. She was 57 years old. She had no travel history. I think it was one of those moments that really caught people's attention as they had started to hear about coronavirus, had heard about it for a month, thought it was something far, far away, and then on the shores here in the U.S. and losing an American. It's also been 1 year since we lost Dr. Wen Liang. He was the one who was he died of COVID-19 in Wuhan, and this is after he was accused of spreading rumors about this, that it wasn't something to be believed, and he sadly also died of coronavirus. So in 1 year, here we are now facing 2.3 million lost globally and 464,000 lost here in the U.S. So it's sort of as we mark the 1 year mark at each point, whether it's the first case here in the United States or first hearing of coronavirus overseas, or the first loss of an American here in the U.S. We can see now with looking back for 1 year now, 464,000 lives lost. Okay, let's talk about a little bit some more news of hope in all of this, and that is the vaccination numbers. We are slowly creeping toward 10% of Americans vaccinated. We're at about 32 million with their first dose. We've got about 9 million with their second dose. That is almost 3%. It's 2 point something in there, but it gets us a little bit closer as we work through these numbers. Now, that is not unlike what we are seeing here in Arizona for our vaccination numbers as well. And here's a really nice layout that we found. Garrett, this is the one from NPR.
Yeah, this is NPR. And this is a great layout because a lot of the charts, including my own with vaccinations, deal with per capita, which is a great way of doing this. But this is the one that we found, Katie, that has the percent of population. And I think in many ways that is a much more digestible data point for most people. And I like it better anyway, because per capita, you have to explain that. Whereas the percentage of population is very easy. It's like a pie chart,
Right.
9.5%. That's the amount of people that have at least one dose. About 3% of the United States have both doses. So really our fully vaccinated rate in Arizona is around 3% right now. And this is done, as you can see, as in descending order. Alaska has a very robust program, and so does West Virginia. As you can see, 14.5%, 5% of their population has been vaccinated fully. To go down to Arizona, here we go. Arizona is at 9%, sort of in the middle of the pack here, and at about 2.1% of our total population.
So this is a helpful spot to find this if anyone's looking for it when we're not here with you. We located it on npr.com. And to put that into real numbers for you, the 9% here in Arizona and the 2.1%, that is 684,000 doses administered for the initial, and then 159,000 Arizonans have gotten their complete set, so their second shot. So Al brings up a good question right there. Any thoughts on when 1C opens? We're a little ways off, Al, and if I remember correctly, you've joined us on here before. If I remember correctly, you're in Maricopa County. Correct me if I'm wrong on that. But because of that, we've still got to get through to 1B. We haven't gotten to 1B in Maricopa County. We're still in priority 1B in Maricopa County. And in fact, in the county sites, not in the state sites in Maricopa County, they're not even to 75 and older yet. So we got a couple more steps before we can get closer to 1C for Maricopa County. Correct me if I'm wrong though, Al, if you're not in Maricopa County. For those of you who are not, let me remind you where we are in that chart. Great time to go through it.
Yes, so exactly. We'll just go through the prioritized phase so that everyone can see that.
Yeah.
as we're saying.
The one thing to note as Garrett pulls this up, 65 and older were bumped up. So when you're looking at the sheet and you're seeing the priority phase, and I've gotten a lot of questions, hey, I'm seeing young people go through. That's because they're education and childcare workers or their protective services occupations. Yes. And then that 65 and older group is the group that got bumped up into priority 1B. Yes. So your area has to denote that it's accepting 65 and older. For instance, we're in an interesting situation here in Maricopa County. Our county sites are not ready for 65 and older. Our state sites are. So we can see where it gets confusing. That's why we're here to help you sort this out. As far as you're looking at this phased in chart, as far as the specific counties go, Apache, La Paz, Navajo, and Santa Cruz are all in 1B plus 65.
Yes.
I'm sorry, Santa Cruz does not have the plus 65. See, it's even confusing for us. Apache, La Paz, and Navajo are 1B and 65. Santa Cruz is 1B, but they haven't added that 65 age group in. Everybody else is only still in priority 1B. So the ones that have the pattern on, I know it's hard to see for those of you watching on your phones right now, the pattern on it denotes that they're accepting that second age group in there. The rest are not even to accepting 65 and older yet. They're still on 75 and older. So I'm getting a ton of questions on my Facebook page. You know, my family member is 67 and they can't get signed up. That's the problem. They've got to only go to the state sites or to the pharmacies if they're over 75, because state sites are going to let you in at over 65. County sites for Maricopa County and several of the others are not even there yet. So it's been frustrating for a lot of folks, Garrett, and we understand it's confusing because some counties are moving ahead and others just are not there yet. The doses are sent out also based on population. I'm seeing some questions about why certain counties haven't gotten a ton of doses yet, and that's why. So that's what Don's asking right there. With so many people above 60, why not more? Because no one at this point is above 60. So anybody's either above 75 or above 65. So we're not even there just quite yet. She's saying she's in Yavapai. So can we pull that chart back up? Yavapai is on priority 1B.
I'm thinking. Oh, sorry, I pushed the wrong button. Our system here added another button on the bottom, and I keep pushing that on accident.
That's okay.
So vaccines, let's see, they are on, Yavapai, I believe, is on priority 1B.
Yeah.
They are, and they are accepting 65 plus right now.
Yeah.
And they've utilized, it says 96% of their vaccines.
So if you have someone over 75, I would check some of these pharmacy sites. Otherwise, that's the way you've got to go. Do we know when the rest of 1B will open up? We don't at this point.
Unfortunately, no.
They've still got to get through that whole group of 65 plus before they even get closer to that. So it's one of the things to consider. Let's see. Okay, Debbie's asking, Dr. Christ was telling the president and VP about State Farm Stadium's +1 vaccine policy. It was really interesting. A ton of people are talking about this right now. So what the idea is that if you go with somebody who has an appointment, you might be the +1 in the car that could possibly get a vaccination. This is in no way at this point a guarantee. And we've asked for a little more clarification after the live stream that happened today, because a lot of people were interested in learning a little bit more. The thing is, it's just no guarantee. So go with your loved one or go with your friend if you're able to, but please don't put any pressure on the volunteers that are out there and the people that are working there, because they only can give it out if they've had enough cancellation day. In fact, they just replied to ABC 15 a little bit more on it. Vaccination is only guaranteed for those in your car with appointments. No one should go to the site expecting a vaccination unless they've got that appointment, that QR code. A +1 is a clinical decision that is based on the vaccine availability at that time. So wanted to update all of you on kind of what that means and what should be expected when you're going out there. I know of some that have gone with family members that were able to get one because they just had extra that was going to time out and they needed to give it out. And I've heard of many others who've gone and nothing. They were not able to get it. Nancy's asking, need to know where in the East Valley they are doing shots for 65 to 74. That would be Phoenix Municipal Stadium. That is the only site at this point, because you've got to go to a state site to get somebody vaccinated that is in between that age group. I hear from so many people, it's too far, I can't do it. At this point, that's the place to go. 75 and older is, your local pharmacy or your local Fry's store. Everywhere else, you've just got to wait a little bit longer. So let's see. Hilda's asking, when are more appointments becoming available at State Farm Stadium? On the daily, just not a big group. When we know of a big group like we did last week, there were like 21,000 becoming available. We got to put it out there. If there's an appointment becoming available now, it's like somebody canceling or somebody, a duplicate appointment in there and they're taking it out, and then that one spot's opening up. So Hilda, keep trying if you've been waiting for some, and then watch my Facebook page too. I post whenever they have different places that they're sending out some vaccinations. Garrett, you had some really good news, and we can take some more vaccination questions too. You had some really helpful news for Yavapai. I know we were updating a question just a minute ago about Yavapai County. It's looking really hopeful there. Yavapai and Cochise County could move, possibly, you're saying, into maybe a moderate category next week.
We are getting close. We're getting close. Let me show you what I'm here. What I mean here. So I'm going to bring up my internals, and I'm going to go to my sort of my lollipop chart that looks just like a
music note chart. I think.
Music note chart. Here comes. There it is.
There it is.
Here's my music note chart. Now let's look at Yavapai. Yavapai County right here. You can see for the week of January 31st, which is the week that we have the most data for, that's the most complete, it is at 98. It's actually under 100 new additions, new COVID-19 numbers since on that week of July 31st. The other site I said was Cochise County is at a 76. So that means that at least for one of the gating criteria, it does appear that as soon as that switches over this week, and I believe it does switch over this week, they will start the process of getting to that moderate transmission rate again, from at least this perspective. Now we'll look at one other thing, and I'll keep this up if we need to re-look at it. But let's look at the and this is going to be a thing for both of us because I haven't looked at this today. We're going to look at the positivity rate for those counties. Because that's the other major metric that we have to watch for. So we're going to go to diagnostic test. Let's go to Yavapai County. And you can see Yavapai County for that same weekend is at 11%. So they're just above the positivity rate for that week. So it does look like they're going to have to wait another week for the week, basically this next week, which would be February 8th will likely be the first time that Yavapai will hit that that moderate transmission. Cochise, let's see where they are. Cochise is already at 9%, so they're going to be there a little earlier, it appears, if there's no sort of change in numbers, of course. And once the state's dashboards move over to those weeks, which I believe, again, will be, let's see, where are we on the state dashboards? Let's go there. We haven't been to the state dashboards in a while because we haven't needed them in a while, but let's just go there. If we go to schools and we go down here to the schools dashboard, we go to Cochise County, we can see that the last week that they've looked at for data is January 17th, which means it's going to be at least 2 weeks for the data to register. So it looks like Cochise County could, in 3 weeks, be put into moderate transmission.
That would be a much different story than we have seen throughout these past few months. So we're hopeful that we'll remain on track for that. Meantime, Maricopa County, obviously, it's the fourth most populous county in the country, but we're in the second spot for cases now. We've now bumped all the way up, and we're in second place for cases. We're still in fifth for deaths, thankfully lower than, where we should be based on population. But for cases, we're in the number 2 spot. So a difficult situation, obviously, for so many families who are going through this. But also, Garrett, that doesn't mean that all these cases that we've seen are currently active. When we look at this active range of cases, you sort of basically you take this number of how many cases we have, 782,000 here in Arizona since the beginning of the pandemic, and you subtract it out based on dates, and then sadly the 14,000 subtracted off for those we have lost, and that gives us a number in the middle based on diagnosis date that helps us understand how many active cases we have. And the range you have finally is back under 200,000. That was a little concerning as we saw that peak over that.
It was getting up to the point where our active case range of under 14, which is the most infectious cases, was over 200,000. So now what we're at is 56,000 under 14 days. Is that's basically what the confirmed case numbers that we know are very likely infectious, because their case number, their case was actually picked up by the AZDHS in the last 14 days. And then in the last 27 days, which is sort of the end of the period for COVID-19, that's when most epidemiologists say, okay, if this case has not been reported as a hospitalization or a death at this point, then we're just going to consider it inactive. It may not be a recovery. There can be some long-term effects, but it's no longer going to be infectious if they're not at a hospital or they're not dead. And that number is 146,000.
So that kind of gives us a range. The other thing that a lot of people have brought up is where we are when we have been worst in the world here in Arizona, not just a worse situation for the US, but worst in the world. I heard a lot of talk over the weekend, trending on Twitter, in fact, and everywhere else about the situation in Iowa and how concerning the rise in numbers were there. I saw them low on that vaccination chart that we just looked at. So where do things rank, not only for Arizona, for Iowa, and some of those other states that might be now passing us by?
Yeah, we'll go to DVOC 91 for that one. I will, let's see if I can generate that. And then I'm going to push this button here, share this screen.
You've already got it?
Oh, do I get it? Yes, I got it.
Oh, so fast. I was going to share one other thing as you were pulling that up. That is that Disneyland California has just announced that mid-March they will introduce an outdoor expo that people can go and attend. It's going to bring back 1,000 cast members to the workforce. So something of note there in California. We've seen things open for Disney World, and not the case in California. Does not sound like it's the full park. It's an outdoor experience there, but something to do in mid-March for spring break if things are staying the way they are and trending down. So wanted to note that as you pull up the chart.
Yes, so here we are. This is the newest data by normalized by population. So it's able to put all the states basically on the same plane. And you can see South Carolina is in the spot of worst state in the country right now. We are now down 1, 2, 3, 4, 5, 6, 7, about 7 spaces. We're about the 8th at this point, and we continue on a very rapid decline. It does appear, at least right now, we're going to be in the middle of the pack here in the next few days. Now, that of course mean, we don't know where our actual numbers are going to look like, but this is where we are right now. We don't know. Right now, we haven't even seen a leveling off. This is just a cratering of numbers at this point as far as the number of cases. As far as the worst in the world, it does appear that Israel is still in that position. Let's see where we are with Israel. Israel is at 75.8 average. And just to compare, and South Carolina's at a 63.8. So it does appear right now that Israel takes that spot. Now, of course, as I've talked about before, this isn't including any other sort of provincial numbers. I don't have numbers in the UK's sort of their quote unquote states or any other places their quote unquote states. So really, this is just nations and the United States as far as our states, and that's what this comparison is.
Yeah, you bring up an interesting point as you talk about the UK. A big change that's happening there. If you now arrive in the UK, they are requiring you to test on your 2nd day in the UK and on your 8th day in the UK, so that they can really get a handle on this and try to get things under control. And as you mentioned, Israel there, it's interesting that they are having high numbers. They are also in this vaccination push. They are one of the fastest in the world for trying to get the vaccine out as well. So, it makes sense when we're seeing such high numbers there that they're trying to make this a priority and get vaccinations out as fast as possible. All right. Let's see some of the other numbers that we wanted to see. A lot of people were asking about variants. I don't know if Lisa Ann's still in the comments here. Lisa Ann was asking about some of these variants, and we have a site that's been helpful to show where they are. For a long time, we were tracking them all around us here in Arizona, and now, unfortunately, we do have a variant here in Arizona. So here's her question. Do you think the numbers will go up again once these variants that we have heard of are more contagious show up coming into Arizona between now and March? And that's an interesting topic, and that's why the rush is on to vaccinate so quickly, is to try to get a handle on this before we see that sort of take over. Garrett, was it the CDC's website that had that great map?
I'm looking at this, and they changed their website.
How dare they not consult with us?
So you're going to have to give me a second while I try to find
That's
it.
fine.
I'm sure it's there, but now I've got to find like a new one. Here it is. Okay.
That's okay.
No, don't change your website, please. Okay, so here we are. This is the variant reported by the CDC's surveillance system. So this doesn't mean, obviously, with these, especially with B117, because of these 3 variants, it is the most highly transmissible. That we don't know what this actual number really is, but they have 690 reported cases of B117, 4 in Arizona, 150 in California, 5 in Nevada. 3 in Utah, 33 in California, and 2 in New Mexico. We do not have any of the other variants, which P1 is the Brazilian variant, which may be as transmissible as B117, as well as more immunosuppressed. It doesn't. The vaccine doesn't work as well. Let's just say it that way. And then B1351, I believe that is the South African variant, which I think does not. It transmits about the same as a quote unquote typical COVID-19 variation, but it does have some. The vaccines are not as effective against that particular variant. So those are the differences between them.
Yeah, it was especially concerning in the AstraZeneca trials. So it'll be interesting to see how they work through that. Speaking of which, February 26th, that is the next big date to mark on the calendar. That is when the FDA has scheduled their meeting for Johnson & Johnson. So J&J is up on February 26th. It feels like a long way off. It feels like I wish they could get this through a little bit sooner, but that's the date that we're working with at this point. So as soon as we hear anything more, we're 3 weeks out from that. So hopefully some good news there. That's intriguing because it's the 1-dose shot, and it could really hopefully help to sort of speed things up.
It's also going to be interesting to see how the logistics work between sort of the 2-dose shot, the 1-dose shot, as well as is there going to be, one of the other concerns is there going to be a logistical issue? As we bring more vaccines to the market, obviously there's going to be more supply of vaccines, but if the administration is done by sort of state and county health departments that have limited resources, that still sort of creates the same bottleneck, regardless of how you can only have so many vaccine appointments if they're being, so how do you expand the dosage administration? And I don't know the answer to that, but it's something that we're going to have to talk about in the next month or so is, how are we going to do that if we have even a new vaccine on the market?
Yeah, it's interesting because it's like for so many different points in this pandemic, there's been a bottleneck of something, like we've talked about, whether the tests or the testing agents or testing site or doses or now possibly this. So Robin's asking, if I got my first shot in a different state but am a Maricopa County resident, can I get my second shot in Maricopa County? I am not sure of the answer to that.
I do not know the answer to that either.
You'll want to definitely check with the health department there and see what type of shot you got. That's one of the big things. So also a passing to note, and we can answer Janet's question in just a moment. We lost U.S. Representative Ron Wright overnight, a Texas representative. He passed away at 67 years old. He contracted COVID and whether he passed of COVID officially, I don't know if that has specifically been out, but he had COVID when he died, 67 years old. So we note his passing. He would officially be the first congressperson we've lost. We lost another gentleman, but he had not been sworn in yet. So technically,
about 2 days from being sworn in.
Yeah. Very sad story. Two little kids at home. I mean,
fairly young, 2 little kids. Sorry. Yes.
So I just wanted to note the passing of Representative Wright as well. Okay, so we missed a question from Janet. I don't know if we're able to answer it. Had the first vaccine at 128 at Gilbert. Still haven't gotten an invitation for the second dose. Should have it on 218. Don't worry. That would be my advice, Janet. They'll likely email you just before. You don't have to have it on the 18th. You have to have it after, but you can go a little ways after. You don't want to go 6 months beyond, but you don't need to be like watching the clock on 217 or 218 and getting worried about it.
That's right. I wanted to, before we get to Gary, I'm sorry, Gary, Debbie is making a good point that I forgot about with the Johnson & Johnson vaccine is because of and I've talked to a couple doctors on this, because of the low storage temperature of the vaccine. This is the one vaccine that they may actually be able to distribute to doctors' offices and to many other places. So very good point, Debbie. That could be definitely something that helps with the bottleneck if you've got family physicians that are able to vaccinate with that particular vaccine.
Yeah, not only the doctor's office, but something we've talked about on here, the dentist's office as well, and really making sure that we're serving our rural communities as well. And I know there's been a lot of groups that have looked at whether this is an equitable transfer, that everybody's getting access to the vaccine, and how do you make sure no groups are left out, no areas are left out, no people are left out, and this would be one of the ways to rectify that.
And we don't know that. And that's one of the issues. I was having conversations with someone today
Mhm.
with KJAZ actually, because one of the things what could be a problem with the vaccine, or at least a concern, is that because all we're getting with the vaccine is these data dumps of just county per county per county per county of the aggregated dose, we don't know what the numbers look like as far as, what is the per capita rates for 65 and up? What is the per capita
Mhm.
rate for other groups that could be impacted? What are the Navajo Nation's numbers? What are all these numbers? Places that were severely hit by the pandemic. We don't know if these are the people that are getting in line to get the vaccine, or if there's issues with the logistics of getting people that need the vaccine the most. So that is a cause for concern that
Yeah.
needs to be addressed at some point.
So the CDC is looking into that just a little bit, and I can maybe link this on my Facebook page or on Twitter a little bit later. But what they're finding, and now we only have the luxury of looking at the first month of vaccinations, but in the first month of COVID-19 vaccination programs here in the U.S., it is mostly women, 50 and older, and non-Hispanic white. So this is why this concern of equitable distribution is a talking point, because here again, women 50 and older, obviously it's that group that they're trying to focus on, but also non-Hispanic white. So looking a little deeper into why that happened or why that could be. But of the approximately 13 million people who received at least one dose, they're saying among the persons that they had the demographic data on, 63% of them were women.
Yeah.
55% were age 50 and older. Again, that's not such a surprise when that is the focus of vaccinating. And then 60.4% were non-Hispanic white. So again, looking closely at that group. And
we know one of the most hard hit demographics of pandemic is actually sort of 65 and older Hispanic men.
Mhm. Mhm.
And so, what does that look like? Are we vaccinating, or is this group of people that have been hit very hard by this pandemic, are they getting vaccinated? This is also a group of people that are likely to work in more essential services positions. They're working they're not, they don't have the luxury. A lot of them don't have the luxury of being a white collar worker and where they can just take the time off. So, there's a chance that there's difficulty getting the vaccine to this group, and it's something that really could need to be addressed. Again, I don't know, because we don't have the data. That's the
Right.
problem. We're speculating because all we can do is speculate, and that's difficult.
Yeah. So that's why they're looking at it, and hopefully we can learn a little bit more from it. But yeah, tighter work settings, tighter living quarters, and then also, as you kind of mentioned there, kind of alluded to there, Garrett, reaching out to any vaccine hesitancy among certain groups to try to work through any fears, and show community leaders in these groups getting vaccinated as well to help set an example for it. Audrey's saying, my husband's 66 and Hispanic, no invitation for the first vaccine. My husband is essential. He is too young. That's why at this point, except if he went to one of those 65
The state sites, yeah,
65 and older, two state sites, Audrey.
Mhm.
So he wouldn't get any kind of invitation. You'd have to go sign him up on there and try to get a spot, and then be willing to go, at all hours in the middle of the night. But those are the only two sites. I'm assuming she's in Maricopa County. Audrey, let us know if your husband and you are not there. But if you're in Maricopa County, because he's so young, there are only two sites open to him at this point. So hopefully that helps. All right. Well, we'll keep watching those numbers. I know it's important to a lot of people to make sure that this is equitable, and so we'll continue to focus on that. In the meantime, we don't have much time left, Garrett, but can we briefly look at some of the projections? Is there a site that you like right now that?
Yeah, we can go with let's see what IHME has had. I haven't looked at them in a while, but let's see if they've updated.
Yeah.
They updated on February 4th. Yeah, that's good enough. February 4th is good.
Yeah.
We can go with that.
Hey, one sec. While you're pulling it up, Audrey.
Sorry, go ahead.
That's okay. That's okay. I'll let you adjust whatever you need there. Audrey's saying she and her husband are in Pinal County. So Audrey, that would be priority 1B county. And we need to see, I don't remember if they are accepting 65 and older. You might be in a county that does not is not accepting 65 and older just yet. So one thing to note, it would be
It is not.
It is
but
not.
I think they can still. You can still go to the state site, and I
You
know
can. You
Pinal
absolutely
County,
can.
the drive to Phoenix Muni is not that bad from Pinal County. So if you
Yeah.
really want to get the vaccine, you can still do that.
So those are the options right now, Audrey. I hope that helps. We'll keep you updated. Join us here any afternoon when we're kind of keeping everybody up to date on what's happening. But those are the options right now. If you're really in a rush to get it, and as you said, no invitation. There aren't any invitations. It's just us trying to make sure everybody knows about what's happening here. So join us anytime. You're so welcome. She says
yes,
thank you.
We have new models. That's why I went ooh, because they changed some things.
You're impressed by a graph.
Yes, I was impressed by the way they changed it. So they've now
okay.
included variant spread in their modeling, and they've also included a mobility. So in those who are vaccinated, so if you have gotten your 2-dose vaccination, mobility moves toward pre-COVID-19 levels. Okay, so those are the ones they're looking at. So what we have here is going up to June 1st. What we have is rapid variants. So the current projection is about 18,600 deaths and that you can see that right there on the for COVID-19. Rapid variant spread that goes to 19,680, and worse goes to 20,929. Daily deaths, you can see in most cases this continues to go down. We are on a downward slide here. The worse. And I have to read a little bit more on the worse, and I'll report back to you as to exactly what it means, because you can see obviously it's impacting the data, and I want to make sure that it's a proper projection. But you can see it says that we would be down in the single digits for current projections. Rapid variant spread could get us to the point where we've still got 21 deaths a day in June, and then worse would keep us at the 50s, which is about a third of where we are right now. Hospital use resources, you can see no matter what, all of the numbers are going down. And then daily infections, I'm taking masks out because at this point, it doesn't really make a difference. We're not, nothing's going to change in that department. You can see that it levels out. The worse, if you will, with the vaccination levels out around middle of March, and it still goes down, but it stays level all the way through March and then continues back to go down in April. And again, this is agnostic to confirmed numbers. This is just who they think would be estimated. They think that around right now, about 6,000 people, give or take, are being infected with COVID-19. In June, if things get worse, 4,480. Rapid variant spread, 1,400. Current projections, 433.
Really interesting. I wonder what that worst overlay is. Just worst case scenario.
This is brand new, so
yeah.
I really got to know what worse means right now. All I'm getting for their definition right now, but I really want to look at the definition elsewhere, is in those who are vaccinated, mobility moves toward pre-COVID-19 levels. So I don't know what the modeling for that is, because just obviously on the face, if you think about that, you said, well, why would it matter if someone who's vaccinated goes to pre-COVID mobility? So now I have to read the white paper behind and see what the rationale is for saying that. I just don't know. I don't know if that's a combination of variant spread or just, the COVID vaccine only being they just don't know how effective it is over a period of time. And I think I just got to look at it and see.
Yeah, no worries. We appreciate you saying when you don't know. We appreciate that. We'll answer a few quick questions, and then we're going to have to wrap things up for today. Janet's asking, any new appointments at the state sites full through February? We have not heard an announcement, Janet, of another big batch coming in. We usually get just a few days notice on it. I'll keep it updated on my Facebook page for you. And then also in our newscast, we'll mention it. But that's when those happen. But check in there. If you have a few minutes, go check in. Make sure you've already registered for your login and password and get all that stuff set. So when we tell you that they have them available, you're able to get right in there. But you never know. You could log on there and somebody cancels and you're able to get in there. Shonda was just asking, is there a way to request a vaccine manufacturer? So Shonda, each site is set up with a different manufacturer. So whichever one you want, just go to that specific site. So it's Pfizer at the state site. So whatever you're looking for, just you can ask that. They don't have multiple manufacturers at each site. It's just one for each. So, all right. Oh, she's saying thank you. Shonda, you're welcome. Okay, I think we are almost, how to register for the pharmacy site, Joanne's asking. That is, go to AZDHS. Can we show her real quick, Garrett, on that AZDHS site? Joanne, I don't want you to have any confusion on where to find that on the AZDHS site, they've got the full list of pharmacies in your neighborhood. Now that includes Fry's. So Fry's might be the best option, Joanne, for you to go to, but look through this list, see if there's something better. It's on the front page of the AZDHS.gov site, and it's got find the vaccine. It's going to ask you to sign up for a time slot there, but then it's also got the list of clinics right here. So look at all those pharmacies that are already getting the shot in. I believe you can also call them directly. It's a lot easier to go through these pharmacies. People have been telling us that they've waited hours and hours to try to sign up on the state sites, and then they literally just call the pharmacy and get an appointment. These are for 75 and older.
75 up. If it's not the state site, 75 up. You will not click into any of these and find one that is, except for the one I just did. What is this?
Where was this?
This one says 65 and up. That's hilarious. I can't. I don't know.
Where is the city? Is it?
This is in
a different county. It's in Tucson.
Oh, it's in What? Where? No, it's not.
It says Ina Road. Is that what you clicked on?
No, this is Mesa that I'm looking at. So I don't know.
It's weird because
that concerns me that they have an address that is absolutely not that location.
Yeah, you're right. When you're clicking on that dot, it's showing up something else.
Yeah, that's Mesa that I'm clicking on, and the address says Tucson. So
let's try another one and see if it pops up there.
That's Stapley. That is correct. This is correct. That address is correct. This address is correct. So it looks like that might be. I just might have been very unlucky in clicking on that particular Fry's. And it was
I did see one other. There's one in Apache Junction that just popped up.
Oh yeah, there you go. One on Old West Fry's Pharmacy. It says 65 plus. I haven't even heard anything about this, that any of the pharmacies were 65 plus. So this may have just sort of quietly happened without telling us anything.
Yeah, I mean, give it a try if you're in that age group for one of those sites.
I would absolutely encourage that. Yes.
The phone number is right there on there. And then you can see too, like if you scroll up a little bit, or if we lose that bar on the bottom, you can see that that's a Moderna site. That's a Pfizer site. So if you're interested in a specific vaccine, like Shauna was before, you'll be able to find that in the comments right there. So hopefully that helps. Joanne, if you have any other questions, and then Janet, you're so welcome. Yes, keep trying, or try one of these pharmacies if the person you're looking for is old enough to go to one of those, Janet. So best of luck, Janet, Joanne. Thank you. And Jackie, geez, we got all the J names right there. Jackie, you're so welcome. Thanks for joining us on here. Okay, that's going to wrap it up. We've gone a little over on our time. We hope you got some valuable information. We hope you're getting closer to being able to find a vaccine somewhere and it's not too stressful. Our very latest coronavirus reporting, as always, is on abc15.com/coronavirus. You can find Garrett on Twitter at Garrett_Archer. And I'm on Twitter at Katie Ramel. His updates in the morning are really good if we're not able to be here with all of you. And then you can also find me on Facebook at facebook.com/news from Katie. If I'm in the newsroom and I see any hint of I'm talking like even Mesa Fire saying they have some vaccines that they're giving out, I'm putting it on my Facebook page to get it out to all of you. So be sure to go actually dig in and look at my page, because if a lot of people don't hit like, you're not going to see that particular one. You know, the ones that everybody's fighting on about something else, politics or something else, those get sent to everybody. And then a little post about, hey, there's like 10,000 vaccines right here doesn't necessarily get out there. So actually go to the page and look through. So hopefully that helps. All right, everybody. That's going to wrap it up for us. We will be with you later this week. In the meantime, wear a mask. Be safe out there.